crisis. Given the associated issues span a number of portfolios, including health and adult social care, will the leader update the Council on what action has been taken so far to play our part in alleviating the impact of the crisis for Thurrock residents?
Thank you, Madam Mayor, and I will try to keep it short. However, there are at least 10 points which the Council is undertaking. But first of all, I'm no denier of reality, but I'm also someone that can look through the headlines and through the terms used to sort of grab those headlines. And the NHS is actually facing the challenges for what they've not planned for. And those that have been outlined earlier, these are the ones where people are not using the NHS properly, and they're just not planned for the future number of people using it. And that's despite the amount of money that every successive government has given them extra each year. We've just had the public health report which outlines some of the challenges that they are facing, and that way we can start working with them to try and mitigate those. But, and I will do this from the top, and unfortunately I'm going to have to sort of cut out many of it. We are working, the social work team is working extended hours over the weekend to minimise the delays release of hospital. We have a very effective rapid response and assessment team jointly with the NHS that will see people in the community within 2 hours to prevent them going into hospital. We are active members of the A&E Delivery Board, which brings all the NHS and local authority partners together to identify hotspots in the system and coordinate our action plans. Full participation in the daily conference calls 7 days a week, irrespective of when. We have increased the number of step-down beds at Collins House, and that now covers 40% of the provision there. Again, supporting people getting discharged from hospital quicker, so we're not bed blocking. Increase the resources within our joint reablement team to help manage the current pressures, and of course the administration is looking to take over the surgery building in East Tilbury to ensure sufficient GP provision in that isolated area. There are also longer term vision. We're looking at a new model of service for domiciliary care that's based around geographical areas that encourage development of community-based services as an alternative to the hospital crisis. Expansion of the early intervention approaches to care, support, and prevention of admissions to hospital. And one thing I really do need to say is a big thank you to the hospital social work team who worked tirelessly over Christmas and the New Year to make sure that our patients came out of hospital, they weren't bed blocks and were back in their homes or places that they should be at a time when they really do need to be with their family.
Yeah, absolutely.
Thank you, Councillor. Councillor Garish, do you wish to pose a supplementary question?
Thank you, Madam Mayor, and thank you, Councillor Gledhill, for that response. I will echo some of that words in welcoming a lot of the work that takes place in Thurrock Council, and I think there's a lot of good work that has taken place, and we've seen, I think, with the report this evening, a framework for a lot of the good work that will take place into the future. I'll pick up, if I can, Madam Mayor, on something that the leader said in his response around not denying reality. Can we take it, therefore, that the leader does agree that the NHS is in crisis?
Okay, I shall just repeat what I said. Again, for the tape, I'm no denier of reality, but what we see through the headlines and the terms such as use as a crisis is what the realities are. The NHS are facing challenges. When we start looking at crises, let's start looking at bigger things. Are you comparing the crisis in the NHS perhaps to the big crises that we see across the globe in places like Syria? I certainly don't put it on the same level. There are problems, and guess what? This government's dealing with it. £10 billion extra over this government to the NHS, and this council stepped up to the plate, cross-party agreement, and we are continuing to do so, as do other authorities across Essex.
Councillor Garish, do you wish to pose a second supplementary question?
Thank you, Madam Mayor. Well, it's very interesting because the Red Cross called this a humanitarian issue. I'll ask you, and I'm really only after a very simple response. Does the leader agree that the NHS is in crisis? Yes or no?
Madam Mayor, I will not be bullied into a specific type of answer. I've been doing this way too long to fall into that. First, I'm no denier of the reality of what is happening, and I can see through the headlines and the terms used that NHS are facing challenges that they have not planned for. This includes the level and the type of way that people are using it. How many more times do I have to say the same thing? Even I'm bored with saying it. Thank you, Madam Mayor.
To pose a motion, and then we need to check it seconded, and then we'll be going to the vote.
Thank you, Madam Mayor. I'm bringing this motion tonight because there is a severe crisis in the National Health Service. It's a crisis that threatens patient safety and is causing misery for many thousands of people in the UK. I believe that we have a responsibility to advocate for the residents of Thurrock, that we do what is in our power to help resolve the crisis, but more, that we take this issue to the door of the government and demand a resolution. The crisis is having a profound national impact. In early January, at least 23 hospital trusts had to declare a black alert after becoming so crowded they could no longer guarantee patient safety and provide the full range of normal services. Steps to manage demand have included cancer operations cancelled, adults treated in children's wards, people left for hours in corridors or sleeping on the floor, and patients languishing in queuing ambulances. It cannot be right for a developed country such as Britain to allow this to continue. Conditions have become so bad that the British Red Cross has described a humanitarian crisis and stepped in to support several NHS trusts under severe pressure. I want to quote their Chief Executive, Mark Adamson, who said, "The British Red Cross is on the front line, responding to the humanitarian crisis in our hospital and ambulance services across the country. We've been called in to support the NHS and help get people home from hospital and free up much needed beds. We've seen people sent home without clothes, some suffer falls and are not found for days, while others are not washed because there's no carer for them to help. Madam Mayor, to be forced to rely on humanitarian relief services in our own healthcare system is a humiliation and one that should shame us all. It should also concern us as community leaders. The crisis isn't something that's affecting some other part of the country far away, it's hitting our residents right here in Thurrock. Basildon Hospital has been on black alert for a significant proportion of the last year, most recently in this month. They've continually remained at a very high occupancy rate. There have been significant cancellations of planned operations. They're under enormous budget pressure. Basildon Hospital finished 2015-16 with a £26.9 million deficit. Tom Abel, the Deputy Chief Executive at Basildon Hospital, said late last year that they cannot balance the number of very sick people we already have in our beds with the extra people arriving in A&E. The current waiting times of patients in A&E are unacceptable. If we review the health landscape more generally, our primary care system is under huge pressure. Our ability to deliver adult social care is under extreme pressure. Our own Director of Public Health uses the word crisis. Madam Mayor, in many ways this is a crisis that shouldn't have surprised us. It's been some 7 years in the making. Underpinning this issue is the fact that we're living longer. Between 2004 and 2016, the number of people aged 85 and over increased by nearly 40%. Across that period, the annual increase in hospital admissions was 3.6%. However, the average annual increase in funding from 2010-11 has been only 1.2%. Therefore, every year since 2010, the financial support for the NHS has fallen behind the growth in demand. We've witnessed a slow motion build up to this crisis over nearly a decade of underinvestment.
Councillor, sorry, 3 minutes is up.
Thank you, Madam Mayor.
Can I do for the minutes? Who's seconding the motion? Councillor Carey, thank you. Right, we now need to vote on motion number 2. So all those in
And Madam Mayor, could I call a requisition vote, please?
Yeah. Okay.
Okay, councillors, I will call out the name if you can state whether you're for, against or abstain for the motion. Councillor Allen.
I'll just do it abstain, please.
Councillor Chris Baker. Abstain. Councillor James Baker. Councillor Jan Baker.
Sorry.
Councillor Baldwin.
For.
Councillor Cherry.
Abstain.
Councillor Churchman. Against. Councillor Collins.
Against.
Councillor Cockshaw.
Again, they don't work now.
Councillor Duffin.
For.
Councillor Fish.
For.
Councillor Gamester.
Abstain.
Councillor Gerrish.
For.
Councillor Gledhill.
Against.
Councillor Howden.
Against.
Councillor Hamilton.
Against.
Councillor Hebb.
Against.
Councillor Cliff Holloway.
For.
Councillor Victoria Holloway.
For.
Councillor Jones.
Abstain.
Councillor Kelly.
Against.
Councillor Cathy Kent.
For.
Councillor Kerrin.
For.
Councillor Lydiard.
For.
Councillor Brian Little.
Against.
Councillor Sue Little.
Against.
Councillor McPherson.
Against.
Councillor Maney.
Against.
Councillor Roger Taylor.
Against.
Councillor Ocanado.
For.
Councillor Piccolo.
Against.
Councillor Pothecary.
For.
Councillor Potter.
Abstain.
Councillor Redsell.
Against.
Councillor Salmons.
Against.
Councillor Sheridan.
Abstain.
Councillor Smith.
Abstain.
Councillor Snell.
Abstain.
Councillor Spillman.
For.
Councillor Hewlin.
Against.
Councillor Tolson.
Against.
Councillor Watkins.
Against.
And Councillor Wheeler.
For.